to write one of these admission certificates under the Mental Health Act. So you don't actually have to be in the hospital. You could be at your local clinic. If the doctor is concerned about you and feels that that three things are happening, so you're suffering from some sort of mental disorder, and I'll get into that definition in a minute, that you're at risk of harm to yourself, or you're at risk of harm to others, or you're at risk of either physical or psychological impairment. So it's pretty expansive criteria. And that you wouldn't voluntarily seek treatment, that you have to be kept in the hospital formally. They will write an admission certificate and they'll send you to the hospital. And they can do that by police, they can do that by ambulance, they can tell you to drive your truck to the hospital and give this to the doctor. I've seen that happen. So those are all ways that someone gets into the hospital. Okay? There's other ways. We have what's called community treatment orders. We'll get into that if we need to.
We go back?
And let's go back now. The other way.
Yeah, keep going.
Yeah. Right here.
Oh, yeah.
I want to talk about this. So, because this tends to get confusing. So what is mental disorder? Do you have to have schizophrenia? Do you have to have depression? Do you have to have bipolar disorder? All three of those can be considered mental disorder. Okay? But it's essentially a substantial disorder of thought, mood, perception, orientation, or memory that impairs your daily living, right? It impairs your judgment, your behavior, capacity to recognize reality, or meet the ordinary demands of life. So essentially, you're not yourself, and or you're very unwell. You can be detained. So it used to be up to 10 years ago that you had to be a danger to yourself or others. Families and communities said this isn't good enough. Our loved ones are suffering, we need to get them into the hospital. They need assessment and they need treatment. Now, that hasn't bared out necessarily to perfect treatment, but it has allowed the physicians, good or bad, to be able to detain people much more easily. So there's no burden of proof or bar. You don't have to be having a psychotic episode. You could be just not taking your medication, not eating well, no longer taking care of yourself. And if the doctor is concerned, they'll issue a certificate.
Yes, sir. Are addictions considered a mental disorder with this?
They would be. So typically not an addiction in and of itself, so without a mental health disorder per se, or a mental health illness, is not going to end up with you being in the hospital for very long. So if someone's very intoxicated, they may end up in the hospital for a detox and then discharged. Ideally, that's the perfect time to talk to someone about what's going on in their life, because maybe there's an underlying mental health issue or 10,000 other things that maybe isn't being cared for, right?
Yeah, but on the flip side, what about, say, let's say like an opioid addiction or meth?
Now,
if you were to videotape their behavior, would that go a long ways to giving this?
Yeah, so what we'll often see when people are intoxicated with any substance, they'll often be detained under the Mental Health Act because they'll try to leave the hospital until they're medically treated first to make sure medically they can detox, and then to determine if there's underlying issues, if treatment in the hospital is the best option. A lot of these certificates that are issued are canceled the same day or within 24 hours or within 2 days because the person has recovered in some capacity. You also, there's people that have had a stroke or a heart attack or epilepsy or something like that. They end up detained under the Mental Health Act as well. And the reason for that is I go in, I'm having chest pain, doctor says it's a heart attack, and I'm like, I'm good, I'm gonna go home, and I have another one in the ambulance bay. They will actually detain you under the Mental Health Act until your heart is stable, because they will go back to mental disorder. Something that's affecting your thought, your mood, your perception, orientation, memory, right? It'll qualify. And do they bend the legislation a little bit to fit sometimes? I think they do. But that allows people to get in, okay? If you're there for over 24 hours, you're called a formal patient. And that just means that they can control you to some extent. And by control, we talk about using the minimal use of force, which is usually suggestions for medication. Sometimes if a person is combative or physically violent, they will restrain you. It can be very, I guess, terrifying to go through and terrifying to witness. The theory is that it's for your own health and well-being. And the theory is that it's done as a last resort, okay? It's not done in every hospital. Here, you're looking at being brought to Lethbridge, maybe Medicine Hat, potentially Clare's home, Calgary, right? So these are the designated mental health facilities. It's not every town's hospital. To keep you over 24 hours, they have to have the medical expertise to keep you in the hospital. Just pausing here, is this applicable or is this really boring?
Wow.
Because I go fast.
See, here's one thing I want to remind you though. You don't have to remember all of this stuff. That's why you have a phone call to make. So as you're trying to think, oh, I'm not going to remember all this, don't forget you can call us.
Phone number, that's what we're here for, to explain when someone's going through this process, what's applicable to them at that time. Because I mean, we won't really get into, unless you guys want to, consent and competency, lack of competency. There's rules and legislation around that, because ideally in a perfect system, we have good checks and balances. So yes, we can take away a person's rights, but with that, there's a whole process for their lack of rights to be reviewed. Okay, and we have what's called review panels. A person will go through the review panel, which will review the certificates, the doctor's reasons why they kept a person there, and determine whether or not they should cancel those certificates and release the person. So there is a checks and balance in the system. It's not always working perfect, but it's better than not having it, I suppose.
So, I just got a question. Like, so when somebody's self-identifying, like I understand this process, but when they self-identify and the system fails them, like they're like discharged, like you're making this up or things like that, but they obviously have addictions and mental health, the reasons they have that, they can't get the counseling to go with it.
Yeah.
Like,
So
that's a breakdown within it, because where's the
Sure it
counseling
is.
within this process as well? It's like you go and you get assessed by a doctor, well, where's the counselor to look at what's causing the underlying
So-
issues?
I mean, I could probably talk.
You know, we were talking about this too with my issue.
Yeah.
We went with my nephew to the hospital.
Yeah.
And my nephew was not in any state to state his own. So my daughter went to admissions and said, okay, this is what's going on, blah, blah, blah. And we went in, we advocated for him. Like he said, okay, I want to go to the hospital. I want mom to come. So I went and of course he was like, oh no, I don't want to go. But we're like, no, the way you're thinking, it's not right. Like to you, in your mind, you make it. But I said, no, we are going. You wanted to go to the hospital, so we're going. So we went, and he went willingly, like somewhat willingly.
It's somewhat
But we stayed with him, and we advocated.
Did you get the help you needed though from the
Yeah,
doctors?
but it's because we went with him. Had he gone by himself, he was in no state to say, hey, this is what I'm going through, this is the issues I've been having, because he would lie. Like even while we're sitting in there, the doctor asked him, have you been drinking, have you done any drugs? And then he was like, no, I haven't. Well, when's the last time you did? Like maybe 3 months ago.
Yeah.
And then the sister's like,
Is it because
oh, tell the
afraid
doctor
to tell
what you
doctors
did.
the
And then
truth?
he's like, oh, I see. Okay, he says, okay, so 3 months ago you drank and took drugs. Okay, you know, of course it was not that long. But anyway, so the doctor says, so this is what you did. Then he says, well, what did you take? So then he was like, and the sister's like, tell him what you told me. And then he was like, well, I took meth and I took crack and I had some weed and I did this. I might have popped some pills and whatnot, you know. Like, but had she not been there, he just kept saying, no, it's been months since I did this, you know. So we were there to advocate, right? And the sisters knew what he's done, and were able to tell the doctor.
I guess
it's
what
lying,
my
right?
concern is,
You know?
I'm glad that there's families supporting him, but there's people that don't have family
You're
that
right.
have mental health that aren't getting that support. So where like what for
So,
these people?
Chris, I think you're totally right, and we do get those calls and stuff as well. What we do want you to know, though, too, is there's no one answer to that.
Yeah.
And so what happens then is we say, well, and as Ryan was just saying, one of the things that we suggest is that you go with your family member. One of the things. So lots of times what our staff will do is say, well, here's an option for you. Now, that might not work. Here's another option for you. Now, that might not work. What you might do is part of this idea together with this. You know, you can always try to do this one if that one doesn't work either. And if you're still stuck, could you give us a call back? Those kinds of things. There's never, in healthcare, there's never a 1, 2, 3 answer. Particularly in mental health care. There's never a 1, 2, 3. 1, do 2, do 3, it'll work.
Exactly.
Never happens, right?
I guess when I just see a friend going through
Brutal.
family issues, not
Brutal.
getting the counseling he needs because there's not enough support for him to
We agree.
navigate that system and see that because he doesn't have that family support because there's a breakdown in the family.
So
And
that-
so that's really hard for me to watch
It
a
is.
friend go through that.
It's not, that is a concern or a call, if you want to call that, that would come to our office on a daily basis. So that is the kind of area that we work in. I mean, when you're in that or when you're seeing your friend go through that, it can be very traumatic, all these sorts of things. You have to think macro level on a bigger picture. In the last 100 years, where our medical system has gone, so particularly in mental health. So if you look at, 70s, or the 70s, 80s even, people were very much institutionalized, right?
Yeah.
And then we thought, well, we will de-institutionalize everything. Everyone's gonna go into community and get better supports. And we started letting people out of the hospital. That's why we have tons of homeless people. But we didn't build the supports necessarily, right? We're starting to. In some communities, we're doing good. I think you mentioned earlier the lack of psychiatric emergency. Well, we've now got that in Edmonton and a little bit in Calgary. That's like 3 years, 4 years maybe, at max. So there's things that are changing. That's not in Lethbridge. We've been to, in the last couple of weeks, I'd say, the Lethbridge Hospital, the Medicine Hospital. We know what services are there versus what needs to be there. So some things take time to.
Is there a way I can advocate for that? Those
By
changes
coming here
we're seeing
today,
in Edmonton and
right?
stuff.
And you're here today, and you can call us.
Okay.
Yeah,
Right?
so
We definitely will have
So
that.
system change, I mean, we've had a lot of reports that government and other organizations have worked on and put out and recommendations that we made, and they actually are moving forward with recommendations. The psych emergency is fantastic, the one in Calgary and Edmonton. There's a couple hospitals that have them now. So for a guy like me, when I have a patient that's called me, I don't even go through the emergency room at, hey, this is what John's issues are, do you want to talk to John? I'll bring him a cell phone, right? So it's a lot different than even 5 years ago. And will that be in Lethbridge and Medicine Hat one day? I would hope so. But those things take time to kind of roll out through the system.
We need to show those success stories that you're
You
talking
do.
about,
You
to
do.
the people making the
And
calls
that's
and
part
stuff
of
in the other areas that don't have it.
Yeah.
That is a huge problem in healthcare in every part of healthcare, and not just in our province, but in many places. Communication is crappy.
Yeah.
Communication is just crappy. The good stuff, the bad stuff, the how we're trying to fix stuff, it doesn't come out until much, much later, and people don't know. And so that's a big, huge issue. It's just communication of what's going on.
Especially when it leads to misdiagnosis. And then I noticed when someone was trying to get help with the counseling, they came over the first or coverage from, or even the hair was covered, so they'll only get services for that. And here there's like other services like art therapy and other, services that help, but that one is covered. This
And
would benefit like that.
I think that's a pretty big issue. So if we talk about people having now gone back into the community and hospitals for the most part being what we call acute care, so emergency care. So if you're under the Mental Health Act and you need psychiatric treatment and you need medication, we have that in the hospitals to some extent. What, as you said, what you may not necessarily have, depending where you are, you might not have a lot of counseling or psychology or social work or whatever, or OT, whatever supports you need built up in your life before you can go back home, right? So there's big gaps there. It is getting better. So again, it's something that you would see, in my opinion anyway, more in Edmonton and Calgary and starting to go out to more of the rural areas, right? I think in Lethbridge we had one social worker.
Yeah.
And usually there's a 2 positions.
Yeah,
So,
no
I mean,
OT.
I mean, obviously Edmonton hospitals are bigger, but there's 5 or 6 social workers in hospital, right?
And I've even read somewhere that for Native people, they can go to treatment and it'll be covered through Indian residential school funding.
Yeah.
But where do we go for that? Like, who do we talk to?
Oh, well, if you'd ask us, we might be able to find out.
Ask us.
Yeah.
Ask
Because I
us.
know people that want to go to treatment
Yeah.
now after, you know.
Ask
being
us, we'll try and find out.
In my old life, one of my old lives, one of my first government jobs is I worked in the income support world, so old welfare as you would call it. And I dealt with it, at that time it would have been IMAC a lot, so trying to get coverage for people and money for people. And so I saw that kind of division, right? I mean, like, for example, IMAC didn't cover, I think, formula for babies. I'm like, how does it not, right? I think it does now. But so you see those vast disparities, and how would I handle that type of phone call today? I can't tell you that I know the answer, but I can tell you that I tried to find out.
That's just what happened with my daughter. My grandson was allergic to milk.
Yeah.
And I did go through the, you're on the reserve list, the health benefit, non-insured health benefit. But she didn't know, she didn't even give me any direction, like who to go to for that.
So in our office, like there's so many different parts of the health system, and especially when you're dealing with many health systems and the feds and all that, we don't know the answers necessarily. But one of the parts of my job, the way I see it, is to find out that answer to get you connected to the next person that will be able to work on that for you. Right? So yeah.
So often you will find our staff saying, I don't know that. We quite regularly tell, it's okay, in some places they say, don't ever tell your customer that you don't know. We just say, yeah, just tell them you don't know, but I'm going to try and find out. I have colleagues that may know more about this. I will research this if I can.
So, the slide before where it talks about the criteria of like the entrance and certify that. So I had like two thoughts around that, and one was, does there have to be like a series of events that lead up to a certificate? Well, you know, because I know that there has been like several overdoses, but I think we could fit that category. And then the other thought that I had was, when you're defining criteria, when you're defining like I know on those pillars that you have, like with the yellow on that first one, it talks about like kind of like the characteristics, the symptoms that can drive or that say that it would have a mental disorder and so people now say that addiction is a disorder too. It is a sickness, it's a disease, but yet a lot of the hospitals, they don't recognize this addiction, this crisis, this trauma that's happening as a form of a mental illness. And like you're saying, like some people will say, oh, I'm okay, you know, I don't have a problem. But isn't that your addiction? Isn't that your sickness? Isn't that your illness? And I don't know how much of your the charter, like the freedoms or whatever, that the right that you have as a person, to speak, does it have that power over it? Or do doctors have the power over it? Like it's just like an argument back and forth.
It is an argument back and forth. Absolutely. And you know, again, it's something that's evolving over time. A doctor, particularly, let's just say an older doctor, would probably say, well, this is addiction and this is mental health. I'm a doctor in a mental health facility. You either need mental health treatment or you don't, or you need to go to their addiction treatment or you don't. Right? So now we're trying to look at, well, I mean, even the government, sometimes they do really good things. So we had health care, and then we have addiction service. And now we have ADAC, right? Now we have addiction and mental health. Is it perfect? Is it all working well together? Not necessarily, but at least we changed the names, and we're starting to work on the programs, right? So one of the hospitals we saw recently, this was a psychiatric unit. There's a unit for addiction assessment, I can't remember exactly what it's called, right next door that they were working on the services to be provided. Some in the community, some in the hospital. So I think 10 years from now, or 20 years from now, our kids are going to be like, you mean 20 years ago you didn't know this, or addiction wasn't considered a mental illness, or they just kicked you out of the hospital? I think things will continue to improve. but in the moment, it feels very stiff.
So then, my other question is, in terms of the, like for example, the color black. Like if somebody comes along and says that, no, it's now called this, and you can shift your thinking and you believe that it's this color or whatever, and it's now this color, and then it could change, so now black is this color. So that's just an example.
Yeah.
But so the meanings of the act itself, the criteria that's fitting into this act, in your, I guess, your experience, has that legislation ever changed where you now add this to take out this, or you can't?
Yeah, legislation is not that specific. So you're never going to see the Mental Health Act kind of open up and have like addiction listed as a mental disorder. It's always going to say mental disorders. What will change is like psychiatric Bible, the DSM. It changes all the time, and they add disorders and they remove disorders, and doctors training, and social workers training, and stuff change with time. I think even I've been in the field about 20 years, but definitely when I started with addiction, now we see that addiction, for the most part, is either underlying mental health, part of mental health, or is mental health. When I went through my training, the only time addiction is considered a mental health issue is if you've been addicted for 40, 50 years, and you have like Korsakoff syndrome, so you have your brain damage due to, say, intoxication or drinking or what have you. Whereas anything else, well, he's an addict, he needs to stop drinking, using, whatever, right? So that has progressed with time, and I think we'll see.
But then there is research that trauma affects the brain.
Absolutely.
Of course.
Absolutely.
And it's happening.
And if we get into like trauma-caused mental illness, so that's a whole nother field altogether. That's just like we're in baby steps there. We're just in terms of understanding how trauma informs our practice, how it informs our health, and informs our needs in hospitals. And also, does everyone need to go to the hospital? If you've gone through experiences, why is hospital always the answer? Where's the in between? So I think, again, we need our community, our supports, and our therapies.
Yeah.
There was another question back there?
Just around training, like the general practitioners, how much training do they get to assess mental health when somebody's in their office? Like, do they understand the trigger points and where that's at, or do you think there needs to be more advocacy on when they're in school to have more training at that level?
I can't really answer that.
It's more of a question for everyone to think about.
Yeah, it is, I think, something to think about.
Yeah.
Or more like, how does training change as the years go by? Or how do we incorporate new thoughts?
So sometimes we even say to people, stop thinking about medicine or healthcare as science. Think of it as art. It's constantly changing. It's developing. There are trends that come in, come out, all of those kinds of things. So what we think is fact, medical fact today, we know in 20 years we will say, that's ridiculous, why did we do it that way? We know that, I know that my grandfather who died before I was born had leukemia and could have easily lived until he was probably 85 years old. He died in his 60s. We didn't know what we know now about treating simple leukemias in the 50s. We just didn't know. So we also have to think, so people can only be taught what we know now. And so it's very tough, particularly when we think about, well, you know, why did they do da 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 when I was 5? Maybe they thought that was exactly what I did do it.
The Doctors Association to say we need them to have training around mental health.
And that would be
That's my
CPSA.
question, because when you go in to see a doctor, they have that right to use this to say they need more help than I can give them.
Yeah.
They need to be assessed, but are they realizing that that needs to happen before it becomes a crisis?
Good
And
point.
and that's where I ask, is there advocacy to be done by people that have suffered mental health and like?
Absolutely. And respectful, pushy but polite, you know. strength in numbers. So some of those things that Renee mentioned already, but those kinds of things are things you need to do. One of the things that I said our staff I think are fantastic at doing is assessment. And a lot of it has to do with just listening, really, really, really good listening. So if someone is telling you their story, listen and ask questions so that you fully understand, so that you know some of this, right? You really do. So these scenarios that we gave you are based on reality. Any one of these could have come in. And sometimes they come in just the way they are. So you might look at this and say, why does someone phone and say, hello, I'm a schizophrenic? Because that's sometimes how we hear that. And what we need to know is we need to make that into reality. No, you're a person. No, you're a person. It's okay. You're just a person. You're just people. That's who we are. So sometimes these are written very differently than what I would say or our staff would say. So you'll see them in that. What I'm going to ask you to do is with the person beside you, so to go through some of these, have like 5 minutes to come up with some ideas. And the question that I'm asking you is, what else do you need to know? Not what are you going to do? What else do you need to know to figure out where do you send them next? Or where do they get the information next? Don't fix it. We're going to teach them how to fix it. Don't fix it. It's harder. Don't fix it yourself. We want you to come up with what other questions do you need to ask? What other information do you need to know about this situation? Because this is going to help you when you're advocating to really try to understand the situation. So I'm going to make, can you come in here? Does that work? Maybe a group of 2 or 3. So come in here, I'm going to give you 5 minutes. You're going to be 1, your question 1, your number 1, scenario 1, your scenario 2. Yes, you 2 are scenario 3. Got it? You're heading up. Okay, you 2 are scenario 4. You 2 are scenario 5. Can we go like 6? With what questions would you ask this person? What else do you need to know? Because purposely, we wrote them so that you don't get enough information here. You just don't. Okay?
What is that?
No more information.
Yeah, we're not, actually, we're not taking yeah, I guess,
I'm not sure why in Ontario.
Yeah, because was in a Royal
The
Alberta
difference
hospital
between
was
the
probably
Alberta
years, and now they don't know
and
do a physical.
Alberta.
yeah, where to go.
That's why they discharged him.
Individual
He had schizophrenic.
they have different.
Hospital supervisor or whatever discharged him.
I know that that's the problem with Uxbridge is like when my daughter's doctor retired, then she's been without a doctor since. And they didn't, in the clinic,
Phone number.
they didn't give them, his clients, they didn't push him off on another doctor in the clinic. So she's been without a doctor for years, but I have phoned around myself, for students, when they're looking for a doctor, when they're
Yeah, we'll, somebody else.
So I guess
Yeah, we'd have to, yeah, we'd have to
Like if
definitely
he's
get
over
some
the age
more,
of 18, it's a different story.
Yeah, that's something we'd have to do, we'd have to definitely get some more information.
Yeah, the mental health act. Yeah, I think that's what it's called. Exactly, so education, where would they get the education from? Tell them to call the health app? Yeah, we're working on number 4. So the questions we're answering are, what do we need to ask to get more information? And we're not trying to solve the problem, we're trying to get them the resources to solve the problem, so where to go next. So, yeah.
How far have you gotten?
So we've just come up with, like, we need to know his age, like how old is he, and maybe call the health advocate, mental health advocate, as a solution to get more information, because it sounds like they don't know the system. Because his son, he was in the Royal Alberta Hospital with
frostbitten fingers, and now they don't know where he is. So obviously he got discharged without being assessed properly. So.
Sounds good.
So you have any thoughts on it?
Let me read it over.
Yeah, go ahead.
That's number 4.
Okay. Okay, so one of the first things that we ask in our office when people call is, what are you calling for? What do you want to get out of this call? What do you want to have happen at the end? They direct it. They may have a million problems, but today they want to tell you about this. We don't even know, do we, if he's got a problem?
No.
Might be somebody else, mightn't it? What else do you want to know?
I would say, are you aware that Alberta Health Services has a listing for family doctors that are taking patients in your area?
Oh, does he even know that?
Yeah.
He might
Do
not
you
even know
You just
that.
gotta go to the website.
Do you
Doctor
think?
so-and-so over there is taking patients, but you have to get there within 5 minutes. So, but
Yeah.
there is a listing.
There is.
Family
Okay.
doctors in the
Do you know how to get to some basic resources? Is that what you're calling about? Sometimes when you ask people, why are you calling us or why are you emailing us, they don't even know. Because remember, they are having that crisis and all of that's happening, and so it's just overwhelming. So sometimes we have to ask them about 5 times in different ways. So is that why you're calling? And sometimes people phone just because they want to have someone
Hear them.
listen. They have felt they have not been listened to before. And I can't believe that somewhere in the health system somebody hasn't listened to them, but they never felt it. And that's different. So maybe this guy just wants to complain. Are you just calling because you want, and sometimes you're gonna find that too with your friends and relatives and family members. They're not really asking you to advocate for you. They're just asking you to listen. And that's kind of a form of advocacy, isn't it? Because you do put that in your back pocket. You say, next time, I might have something, right?
Sometimes
okay.
just listening helps them figure out the problem themselves.
Or
'Cause when you have
themselves.
mental health, it's sometimes just the process.
Not even that. When I've got a sore knee, I gotta figure out what's wrong.
I used to work with the bus driver dispatch, and some of the calls we'd get would be like, I ran out of water, who do I phone? And I'm like, Public Works? Like, are you seriously calling 911 because you're out of water?
I know.
So, yeah.
Okay. Anything else? Anything else anybody want to add on this? Great job. Anything else? That's it. Okay. The 2. My mother was recently treated at the Royal Alec Hospital. You could just exchange this for the Lethbridge Hospital. She had an infection that was not properly treated, and then she was sent back home before she should have been. I've called her doctor several times, but he hasn't got back to me. I'd like some help with this. What else do you want to know about this story?
I have a few questions. What kind of infection does she have?
Okay.
Yeah. What was the medication given? Another is, when was she given the medication? Because often it's like a person can seriously die if, flush it out.
Okay.
And then, are you trying to contact a resident or doctor, or like the ones that helped in the hospital and the ER ones?
Yeah.
Or your family doctor, because it's not explicit here. I mean, if you're trying to contact somebody from the hospital, good luck, they will never get back at you. But if it's your family doctor, yeah,
Maybe.
you have more chances.
Yeah.
And then the other one is, have you been back to the hospital after that? Because
Good. Those are all really good questions. Okay. What else, you guys? What else can you think of you need? Think about this one. So I'm going to I'm going to pretend that it's when I'm 20 and this is my mother, and so she would have been 45. What else do I need to know about this? What else do I need to know about this story?
What would you call the Alberta Health one? When I thought my grandson ate some pills, I called that 1-800 number, and then they said, oh, what are the symptoms? So,
There's an idea.
and then they said, okay, you should go to the hospital, or it's not, if it's life-threatening, blah, blah, blah. But they advise what to do.
There's one really secret one that's in this. What if it's you today, and it's your son or daughter who is 15 and is saying this? Does your son or daughter who's 15 have a right to have all your medical information? Maybe not. Not if you're your own decision maker, right? So this person is wondering why the doctor hasn't called back. We need to know a little bit more. How old's mom? Does mom her own decision maker? And then, not properly treated, what does that mean? Not properly treated by whom? Discharged too early by who? Your mom? You? Your dad? Your, you know? Who said not properly? The nurses? And they argued with the doctor? Right? So lots of really good questions. We need to know more about the story. So don't ever be afraid when someone is telling you a story to say, well, then what happened then? In fact, we might not even need to know what that infection was if she's her own decision maker.
Especially like if you're the one, if your elderly mother or whatever is in the hospital or getting treated, and the doctors and nurses are using terminology you don't understand. You know, I've had this happen with my sister. My brother was in the hospital. She called everybody that he was on his deathbed when he was not, and then we all rushed to Calgary only to find out, why didn't you call us? Because she didn't understand what the nurse was talking about. And the doctor, right? So it freaked the heck out of everybody. So it's just the terminology, and then make sure that this person understands what has been said to them.
So right? One of the biggest things that our staff say is exactly what you just said. Ask questions. That is one of the biggest tips that we can give you about anything within the healthcare systems. Is you go into any appointment with questions. Have questions ready. If you're not sure what's going on somewhere, ask a question.
So what if a doctor gets mad at you because you made that example only 2 questions allowed? When
well, and so, but do you hear what Ryan said? Ask them how many questions is okay. Because if you said, because if the doctor says,
still not clarified within those amounts you give?
So then you say, I have more questions. What would you like me to do with that? Another question. Okay? I have more questions. How will we address that? Shall I come back for another appointment? Should we make arrangements for something?
And in that case, because of where I worked, I asked the doctor, why do you have a sign that says only 2, I have 3? And what he said, well, people, you know, and he's from, my doctor's from Iraq. He says, people from my country come in, and they come with 20, 30 issues, 2 of which might be medical, but the rest are family, community, legal.
They tell their whole life story.
I'm trying to teach them what are the right places to go and give them the right resources. He's actually a fantastic doctor.
Okay.
So he explained the why behind that,
Yeah.
so he can help his community grow and find the right resources.
Well, no, it's interesting. When you talk about time of a doctor, they're really busy with a lot of patients because their caseloads are busy. So it's like that it's a fine line between spending enough time with the patients and not enough time.
But
so
there's
I'm not condemning a doctor for putting that up.
No, and there's nothing saying that if you ask, you ask the question. I have quite a few things to talk about. Is it okay if we do it now? Ask another question about. There's nothing saying. They can say no. No, you know what? There's a guy bleeding over there. I don't have time right now. Okay, fair enough.
I've got very lucky.
Fair enough.
My family doctor giving me his personal home number because I've known him my whole life. So some doctors are willing to do that. So
last time we went to the emergency, we didn't even know who the doctor was because the doctor never introduced themselves. The nurses, I didn't know who they were, or housekeepers, nobody said who they were.
I know, and you know, I can tell you when my mom was in supportive living, I mean, she's long gone now, but when she was in supportive living, and my sister lived closer to theirs in Vancouver, and she said something, my sister said, oh, something that's going on with mom, and I said, did you tell the staff? And she said, oh yeah, I did, and I said, which staff did you tell? She said, well, I don't know, she's a woman in the hallway and she's wearing a uniform. Well, the only ones that wore a uniform in that building were the cleaning staff. Well, chances are that, so we might think that, and if I really believe in an interdisciplinary team, the cleaning lady or cleaning man should really be talking to the treatment team. But guess what? They don't. So that message is not getting through. But unless I ask, I don't know. And then I may even have to say, so you're the cleaning staff. Do you actually meet with the rest of the team? No, I don't. Thank you. Then I'll go and find the person who does. Thank you very much. Ask a question. It doesn't make you look stupid. It makes you look smart. It makes you look smart because you understand how complicated the healthcare system is. All of us who know how complicated it is, like you just saw that picture that he had with all those arrows and, oh my Lord, that's why. We have to have people who are specifically educated in that. We know it's that complicated and we know it keeps changing. It makes you look smart to ask the question. The other thing that was involved in that was perhaps if this son or daughter had written some things down. So that appointment, so that phone call that says, sometimes if you write it down, your family members can see it and then interpret it and go, it's okay. Or sometimes if I take my good friend with me to the doctor, because I'm gonna be upset. I just found out they've got to, I don't know, take off my toes. And I'm thinking, oh my goodness, they're going to? But I say to the doctor, you know what, this is my good friend Sally, sorry. This is my good friend Sally, and anything you can say to me, you say to Sally as well. I'm giving Sally consent to have this. And I give my, my friend Sally the pen and paper and say, write down everything, okay, write down everything. Write down it all, because I'm gonna forget, because I'm pretty sure he's gonna tell me the toes are gone. So, so at that point then, when I go home and I think, it has to happen next month, right? My friend Sally says, no, look, no. This is something that could happen anywhere from 3 to 6 months. Right, because at the time, it's hard for me to absorb it all.
When my son got, when my son got in trouble with the law, my friend happened to be with me when the cops called me. And I couldn't understand, like I just could not fathom what he was saying. And I said, you know what, my friend's right here, could you just tell her exactly what you told me?
Yes.
And then, like, I never even thought to ask questions, right? I was just like, what? You know, and then she was like, okay, all right, what happened? You know, and then
It's a great technique.
Yeah,
it's a
so
great
she took care of
technique.
it and thought of things that I couldn't at the time.
Fantastic
I was
technique.
traumatized.
Yeah.
If you're alone and you don't have anyone with you, can you record it?
You know what? If you're going to record things, say you are. Because some people are going to be afraid of why. Particularly if they're really good. So, or if I think I'm really good. So if you were to tell me you're going to record me in a bunch of interactions, and I think I worked really hard at being a really great nurse, and I do, I'm working so hard on this, and then you tell me that, you know what, I'm going to have a meeting with you, and I'd like to record it all. I'm like, yep. But if you precede it, no, wait. I'm not saying you don't do it. What I'm saying is, it's important to talk about why first, and ask. So, I want to remember everything, and I'm really worried I'm not going to. I don't have anybody else here with me. Doctor, would it be able to?
That as public servants,
Yeah, so-
you have the right to
And this is
report.
something public servants don't know.
Yes.
So here's a piece, what public service don't know, and they will freak out, is you have every right to record any call, any conversation with people who are public servants. You should, as Catherine says, like I explain why. Like I actually did it to 3 doctors the other day and I put them on their toes. But to say, like, I need to be able to translate this to others, or I need to be able to take this, and I need to be in the conversation. I don't need to be like this. So just being
That's
able to say,
important.
but you have
Explain.
every right to record calls with public servants, child welfare, you name it. You have every right.
However, I want to make a point. Because you have a right, doesn't mean you should yell and scream, I have a right.
Yeah.
That's
how you approach
It's
it.
how you do it. It's how you do it. So, am I going to be offended if you immediately say to me about absolutely, I have a right to go to the bathroom before you? Well, then I'm going to go, yeah, well, thanks. Well, you probably do, because you're the one who's doing the dance, and I'm not. You know, you have a right to that. But there's a difference in, excuse me, really means absolutely, you go, right? That's the difference. If you want to get the full answer, if you want to have the best chances of getting the most information, that is your last resort. Before you say, I would really like to because I need to know the information. So when we get a call, one of these ones, and the first thing they say is, do I have a right to, we had one very recently, someone said, do I have a right to help my mother out of her bed and onto the toilet? I used to be a nurse, do I have a right? No, you don't actually. You have no right to do that. Could you do it? Probably. Have you talked to anybody about it? Or did you just go in and say, this is my mother, I'm helping her. I used to be a nurse and I'm going to help her. And they don't know you used to be a nurse. And how old are you? The lady was 75. They might have been worried that she was going to get hurt. They might have been,